So my name is Janine Taylor. I am a certified clinical aromatherapist. What that means is that I work with people in a clinical setting. So as if you were to come to me as a client, I do a complete health history. I want to know what medications you're on. I want to know what kind of massage therapies you're working on. I want to know what your health concerns are, like the TMJ. And then we address them from a clinical perspective. Now, in order to get to that level, I actually had to go through a master's degree program. I have a Master's of Science in Aromatic Chemistry and Aromatherapy. And my focus in my practice is primarily on geriatric and hospice patients, but I work with everyone. And what I found is that there's a lot of stuff that essential oils can do. There's a lot of stuff essential oils can't do. I have a torn meniscus, most likely. There's no essential oil in the world that's going to fix that. Not going to happen. It's the same way that I'm still trying to figure out what the correct essential oil for appendicitis is. Again, not going to happen. But there's a lot of things that essential oils are good for, and they can be used on their own. They can be used in conjunction with traditional medications. They are incredibly effective with certain techniques, such as massage. So the question that we need to work through when I work with my clients is, what are your goals? If it's okay, you mentioned you have TMJ. Well, there's a couple of things going on there. As Anna mentioned, there's some cranial sacral fluid going on. There's some inflammation. Those cortisone shots, they're not fun. Had one in each knee yesterday. Yeah, it's a regular occurrence, unfortunately. Okay, but they work because they reduce inflammation. Well, there's a lot of essential oils that can help reduce inflammation, and you put them on topically on your skin. Please don't drink essential oils. Please don't. It's not good. In your packet, there are actually 4 recipes here, and one that is very, very common that I use for inflammation is on the bottom right. It's the really thick card, because you can actually break these apart and they break into their own little cards. The inflammation rollerball blend, this makes up into a little 10 milliliter bottle, and it has a variety of different essential oils whose function, when applied topically, is to draw out inflammation. And because you're putting them right where it hurts, and believe me, my knee has been slathered with them, okay, they do work. They're what we call for acute. In other words, I just did this is acute. It's not a chronic. After 3 months, your TMJ is probably chronic. So the way we treat them is a little different. We use higher blends, higher power blends, if you will, stronger blends on acute situations, because we want to get that out. We want to knock it out. Chronic, we tend to use lower blends, lower power blends, and use them for longer. And here's the good thing. You see all these essential oils on there? There's probably 3 more lists like this of oils that are just as effective. And we can blend them in different ways. You don't like an aroma, we can fix that with an essential oil that does help. I also like to use specific carrier oils, because hemp seed carrier oil is great at knocking out inflammation. Coincidentally, it's the same hemp seed oil that you can get to put on your salad. And go grab it in from the grocery store. It's excellent anti-inflammatory. So that's just one of the many things that we can do. Now, when we talk about headaches, you know as well as I do, there's a ton of different kinds. There's stress and tension headaches. There's headaches from an injury. There's the dreaded migraine that we've talked about. And so these are some blends that have worked well with my clients, as well as a generic pain blend. But one thing that I want you to concentrate on is, if you do suffer from migraines, if you do have someone you know and love who suffers from migraines and they're using essential oils, you want to be careful, because if you look at this, there's an awful lot of essential oils in this blend, and I usually don't do more than 5. The reason there's so many of them is because it's an aspect of the way our brain works, kind of like Steph said. We begin to associate a certain aroma with a migraine. A friend of mine did that. She was taking peppermints and using peppermint oil on her temples when she had a migraine. Now, if she smells peppermint, she gets a migraine. And so that's why we want to avoid those triggers. And that's why this is one of the few recipes I have that has so many essential oils. I normally don't like to do that, but for migraine relief, I do. The main thing to remember with essential oils, less is more. Most of these blends, quite honestly, are in the 3 to 5% range. So in a 10 ml bottle, there might only be 9 or 10 drops of essential oil, because that's all you need. You don't need 100% essential oil. When 3 to 5 works, yeah. And then you run the risk of getting sensitized to it and all kinds of bad icky things. So as a part of supportive care, there are many things we can do in the aromatherapy world to support the care you're actually getting from our massage therapist. But please, if you do want to explore that, let us know so that we can coordinate, because it may be that in the case of your TMJ, we might want you to use an inflammation blend a couple of hours before you come in and see Anna, because then that'll have time to get in there and loosen a little bit of it up, and her work might be a little easier. So that's the kind of coordination that we can do here for you, and that's partly why I joined this amazing group, because it does allow us to all work together. Now, the other question I'm always asked is, what books do you recommend on essential oils? And this is in your packet as well. These are the 2 most common books I recommend for people to start out with. They're good, easy, simple books to understand, and I know both the authors. Then if you want to get a little further into it, there's one that works the aromatherapy for healing the spirit by Gabriel Moje, wonderful Englishman. And he focuses specifically on using essential oils for your emotions and how you can help with that by using these certain essential oils. So these are just some recommendations for you if you have any questions. My card is in your packet. One of the raffle prizes is actually a 30-minute consultation with me. I see clients, actually I'm on the other side of this wall, and I would love to help you if you would like. Just let me know, because whatever you choose to do, we want to help you, whether that means getting over pain, whether it includes getting more flexible, dealing with those headaches. Let us know how we can help. That's what we're here for.
For more information, please visit our website at www.nurturingnaturemmassageplus.com.